in terms of PDF, because that's where most of the questions are hidden, that you need to compare superficial with cutaneous, cutaneous with systemic, so on and so forth, looking at the structural element, what are the differences between the clinical picture, lab diagnosis, and so on and so forth. So let's see how far do we go for systemic mycosis. These are the three important dimorphic pathogens that we normally see: blastomyces, coccidioides, and histoplasma. So these are three important, and sometimes I wonder, people say, oh my goodness, I don't know how to remember all these things. You will see them clinically, right? You will see them clinically. And Dr. John Esterly, he just moved from, he retired or resigned to another place. He was the one, the clinical infectious diseases, and he told me he does see quite a lot of patients. So don't get fooled by, it's too difficult, who's going to take care, and things of that nature. So these are really important dimorphic pathogens that we normally see. And again, this is one of the comparative slides that I said is there in your those PDF that I posted. And you can see they are also saprobic and parasitic endemic dimorphic fungi. So you have histoplasma, you have blastomyces, you have paracoccidioides, coccidioides, and penicillium mold. So you can see each one of them exists in two different forms. So you can see on the left, for example, the change of temperature. So change of temperature is going to determine the type of microscopic appearance that you see under the microscope, okay? And you can also see over here that, of course, you cannot inhale the bigger chunks of that. So what you're going to inhale is the smaller pieces of whatever is shed off from there. Okay, simple. So you can see, and again, some of them are larger as compared to the others. Now, for routes, many type, when we talk of these terms, and these are a couple of slides for, again, a recap of what I've already told you, is that you can see when we talk of deep mycosis, it can go in brain, lungs, heart, spleen, liver, kidney. So these are the deeper mycosis when you have fungal infections of the blood. The other important thing that you will see is, as far as the routes of entry are concerned, nasal sinuses, it goes to the lung. You can also have a injury to catheters, and then you can also have kind of taken into gastrointestinal tract, all the way from oral cavity to rectum. And then again, that's where you may have normal commensals as well. And again, cutaneous mycosis, we already discussed that earlier in the first few lectures. Now, this is one of the typical example of a mycetum that you see like a flower-like thing, and it has this conidia on the top. So you see conidia, so they get blown up and form some kind of endospores, and you inhale it. So you inhale it, it's going to go into your lungs. It can also go to your esophagus, but then it's going to be absorbed. It can cause local damage that you see, septate kind of inflammation, be absorbed depending upon the size. Remember, I asked you the size, pass through that, and then go into your blood. If you look at the world statistics in terms of what is going on over here, so let's concentrate, let's see, for US, for those of you who are interested in that. So let me enlarge that. So you can see from here that half of US, you can see from here, half of US, the eastern half, and a part of the southwest, you can see from here, has tons of infection that we normally see of blastomyces. You can see blastomyces is so prevalent. Okay, and then again, paracoccidioides and the histoplasma are also there, but mostly in the lower part as compared to the rest of the world, like, Western Africa, and also part of Far East, and then some other countries that are not listed here are important in terms of the world scenario of what kind of infections that we normally see. Now, this is again a recap slide. We've been talking about dimorphism, and the idea for this is, again, you can see from here that the cycle is split into two, half of them like a plant-like thing, and half, so this is more of a natural habitat. So most of the fungi that are dimorphic, they basically live in a temperature. So you can see the temperature over here, which is most of the time less than the body temperature. And then it is going to form spores and be released in the environment. And that environment is shared by you or any animals, warm-blooded animals inhale, and then they will become a yeast phase as compared to the mold phase. So mold phase is more like a plant-like thing, which is in the environment, and the yeast, the smaller like places that are there. But again, is a continuous circle that goes on and on in terms of, you are pushing that thing into the environment, and the environment is pushing back into you. Okay. Again, this is a master slide. It's also there in PDF, and you can read it on your own. But you will see that basically this is like a schema in a broader sense, and it's not from micro book as well. It's a basic biology book. Because it was nice, I just picked it up from, I would say, a 2000 level biology course in any city college of Chicago. So that's where it's coming from. But it's very good information as to what is it that you look under the microscope, and what is it that you look under the petri dishes, and how the whole broader scheme of a diagnostic workout is when you talk of fungal infections, right? And pretty much the detail of that is given into the PDF that I've already added over there, and I'm going to show it to you tomorrow as well. So you will be in a position to find out how and why you want to go for one particular test as compared to the other particular test. But this is a good comparative picture. The other thing that we've been talking about, again, you can see another example in the same book. I'm just picked up some basic biology pictures because I thought they're more explanatory that what we talk in terms of detail. Again, pigeons dropping, a bird dropping, the person is running, is going to pick up this, it will go into the lungs, he gets sick, and then it goes to the blood, and the blood takes it to all the different organs of the body straight in terms of endemicity. And then again, one other important aspect you can see from here, the role of neutrophils, because neutrophils are the professional phagocytic cells. So when you say neutropenia, you are losing professional phagocytic cells. These are the cells required for phagocytosis and removal of all microorganisms. Okay, if they are absent, because some of the drugs like chloramphenicol and other drugs will hit the bone marrow will not produce the cells. One of the cells that will take hit is neutrophils. We don't want that to happen. If it does happen, then we are in trouble. Okay. The other important thing in this case is, again, occupational, same set of chapter from biology slide. You can see from here environmental thing, and the environment, soil, and soil has those plant-like hyphae. Again, the person is going to inhale that, and it will complete. The mold cycle is completed in the environment, and the yeast cycle is completed in our body. And then again, it can go to bones. That's another important aspect, because something that goes in bone is very difficult to treat. It's very difficult to treat when it goes to that level. This is from your book, and all of the things that we have discussed earlier in different lectures, that's what I was talking about, that you may want to compare them in terms of what is the cause, and what is the geographical distribution, and what is the morphology. So these are like comparisons and contrasts that are there for you to prepare. And I think Ransford is going to help you that, because last year students made a lot of concept map, and a lot of literature is available. But I think that the book has done a good job, and it has missed all those tables for you. But if you want to make your own, you can still do so. So the point is that so far we talk about dimorphic fungal pathogens. Again, in the laboratory, they are at lower temperature, right? And in the body, they are at higher temperature. So this is another important thing. I don't know how many times I'm going to stress it, but keep in mind that's what dimorphism is. And then again, all those groups which I talked about, especially in this case, since we are talking about H. capsulatum and C. immitis, they are opportunistic pathogens, especially for AIDS. So for AIDS patient, we really have to do something, because they get, as I said, one of the common presentation other than generalized lymphadenopathy is thrush. They present you with thrush. And you would have noticed that if you give too much antibiotics to the patient also comes with thrush. So have this mouth fungal infection. That's the key, because you give a chance to the fungi to overgrow the normal commensals. Okay. Now, another picture of seeing, you can see from here, these cells that have taken into small. That's what I wanted you to know, the size of those small conidia as compared to the cells. So what yesterday or day before yesterday, I asked you, what is the cell which, like red blood cell, and you told me it's a 5 micrometer diameter or size. What is the size of a neutrophil? Louder, it should reach me. I think you want to say something. Well, it shouldn't take that long for you to figure out a size, because of course, if the conidia is 5 micrometer, right, and I told you need neutrophil to phagocytose, so phagos cells will be bigger than that. But yeah, you got it from Google, I can tell. So 12, it should be snap, because if you take time, immediately I think there are Googlers over here. 12 to 15, that is correct. 12 to 15. We had when I started having this extra credit questions, some of the people came to me and told me that some of our students are very good Googlers. So you give all your points to Googlers, that's unfair. So, I think there's no control, but what I think that if you know the answer, it should come up snap. If it takes more than 5 seconds, there's a Google time. No. Okay. Last slide for blastomycosis, Chicago's disease. It's also called Chicago's disease. Your book doesn't say that, but traditionally it is called Chicago's disease because it's very common over here. And then again, pathogen is blastomyces dermatitis, and it's also present in many different parts of the world. And if you look at the morphology, pretty much exactly the same scenario. All the slides are more or less repetitive, because the moment I say dimorphism, I may have a slide over there, but it pretty much mean the same thing, same temperature. But the important thing for this is that if I tell you that, for example, the size of conidia, you see that 2 to 10 micrometers. That's why I said neutrophils. So that's always one of my favorite questions. I ask you the sizes of the cells and sizes of those particular conidia, and make sure that you know. So that's the Chicago part, because we do have trees, and the molds which are there over here, and also are taken up by humans and animals. In this case, it's also a disease for pets like dogs, and then it's going to go into the respiratory tract, and then can be disseminated. The most important thing for this particular blastomyces is that, as you can see, that it exists in the environment in like a plant-like fashion, releases those small conidia, and then they are taken up. The important thing in this case was that they are taken up by macrophages. Okay, and if I ask you, what would be the difference if a fungi is taken up by a neutrophil or taken up by macrophages? What would you think would be the major difference? Okay, think about that, and we'll ask this question.